Hello, my name is Karla Loss. I'm a pediatric cardiologist and teaching assistant too. In PPCR, I'm involved with the program since 2017 as a student and 2018 as teaching assistant. And today is my pleasure to discuss a topic that I really enjoy, which is risk ratio and odds ratio in clinical research, difference and similarity of both parameters. Why they are important, and I would like to invite you to watch my presentation to reflect about these both important but tricky measurements of association. So as objective, I would like to describe the definition of risks and odds, interpret and calculate risk ratio and odds ratio, and when it's appropriate, the use of each one, and why we should choose one, or should we choose one or not. So let's start. So let's start with an important question. Why do we care? Why risk and odds are important? So first of all, in clinical research, it's very common to have binary outcome. For example, death, relapse, hospitalization, disease presentation, for example, stroke, myocardial infarction, or any other, diabetes, hypertension. And the association between a risk factor or any exposure and a binary outcome, the ones that I described previously, can be assessed using risk and odds and the ratios of each parameter. So let's start with an example. In this case, we have a 2x2 table describing the exposure factor, anemia, yes or not, and an outcome, the mortality, death, yes or not. In the exposed group, we have 20 patients that developed the outcome, death, and 80 patients that did not, in a total of 100 patients in the exposed group. And in the group that had no exposure to anemia, so no anemia, no risk factor, no exposure, we had 5 deaths and 95 alive patients from a total of 100. To calculate the risk, what we will use? We'll use the number of deaths of patients that died in the group exposed divided by the total population at risk, in this case 100 patients. So to calculate the risk of having death or die in the group exposed to anemia, we will use 20, the number of patients that died, divided by 100. Why? Because 100 was the total population at risk in the exposed group. The risk in this case will be 20 divided by 100, meaning 20% risk of dying in the group exposed to anemia. On the other hand, we had 5 patients that died regardless of being exposed. So even being not exposed to anemia, still 5 patients died. And the total population at risk in this case was 100 again. So we will divide 5 by 100 and we will have 5% risk. So being non-exposed to anemia, you still have 5% risk of dying. So this is a very simple probability analysis, risk analysis. However, we can also calculate the odds. But the odds, it's a different parameter that we are not interested in the total population at risk. Why? Because sometimes we don't know. We don't know the number of populations at risk of dying. So we will calculate the odds. In this case, the odds of dying in the group exposed to anemia is still, the numerator will be 20 patients that died in the exposed group, divided by the number of patients that are still alive. 80 patients are still alive even though they were exposed to anemia. So divide by 80. So the odds in this case would be 0.25 in the exposed group. And the odds in the non-exposed group, the group that had no anemia, was 5. Still, we had 5 patients that died being in the non-exposed group, and the number of patients that are still alive is 95. So in this case, is 5 divided by 95, and the odds in this case would be 0.052. But we are interested in the ratio, right? Not only in the risk or odds. We are interested in to understand the risk ratio between the group that were exposed divided by the group that were non-exposed, to understand if the risk of developing the disease or dying is greater or smaller than 1. Why? So risk ratio and odds ratio are measures of association. Why? Because they will assess if the exposure is a harmful or protective factor in an investigation to develop a condition, a disease, hospitalization, or relapse, or any binary outcome. If a risk ratio or odds ratio are greater than 1, we can say this is a risk factor to develop the outcome, to develop the disease. If the number is equal to 1, we can argue that there is no association. On the other hand, if it's smaller than 1, for example, 0.6, 0.8, we can say that it is a protector factor against to develop the disease, right? So in this case, I would like to share with you another example. For example, we have 18 patients in each group, exposed and unexposed, and I would like to calculate the risk ratio and odds ratio in this case. So, for example, in the first example, I'm calculating the risk ratio. The risk of developing the disease in the exposed group is 11. The total number of patients that develop the disease, the pink circles, divided by the 18. Why 18? Because 18 patients were at risk to develop the disease. So the risk is 0.61. On the other hand, we need to calculate the risk in the non-exposed group. In this case, we had 6 patients that developed the disease, even though they were not exposed, and 18 patients at risk. In this case, the risk ratio is 0.33. So the ratio between the exposed and unexposed group is 1.84, meaning that the patients exposed to the condition, to the risk factor, have an increased risk in 84% to develop the condition, the disease. On the other hand, the odds ratio are very similar. We will calculate the ratio of the odds of being exposed and not being exposed to develop the condition. So the first odds we will calculate in the exposed group. Again, we have 11 patients that develop the disease. The numerator is the same, the number of patients that develop the disease, but the denominator, we are not interested anymore in understand the total population at risk. We want just to describe the number of patients that did not develop the disease in the exposed group, in this case, 7. So the odds in the exposed group is 1.53. On the other hand, the odds in the non-exposed group will be 6. Again, the numerator is the same, divided by 12, because 12 patients did not develop the disease. In this case, the odds will be 0.5. The odds ratio to develop this disease is 3.14, a very large odds ratio. Interestingly, the odds ratio will prove Similar conclusion, so this risk factor, this parameter is a risk factor to develop the disease, but we cannot interpret as we interpret the risk ratio. It's not increasing in 3.14 times to the risk of developing the disease, but we can interpret that the odds ratio of 3.14 is equal to say that this risk factor, being exposed to this risk factor, increase the odds to develop the disease in 3.14. We are saying that both parameters are risk factors, will increase your chance to develop the disease, but it's not a direct effect as we would interpret probabilities or risks. And we should reflect, how should we choose one or other? The first thing that you realized was the denominator is different. Sometimes we don't know the population at risk. If you don't know the population at risk to develop the disease, you can only use odds ratio. And this is the case for retrospective studies, particularly in case control studies. You are not following the patient prospectively, everyone without the disease being exposed and non-exposed to a condition to understand the number of patients that will develop prospectively a condition or a disease. But you took already the patient that had the condition and the patients without the condition, and retrospectively you will investigate if the patient were exposed to a potential risk factor or not. So the population at risk is unknown. Odds ratio is the adequate parameter to be assessed to investigate mathematically or statistically if the risk factor that you plan a priori to investigate is a real risk factor for the condition. On the other hand, when you have a prospective studies, a prospective longitudinal cohort study, when you take everyone, 100 or 200 patients without the disease in the exposed group and 200 patients without the condition, healthy patients, non-exposed, and investigate prospectively who will develop the condition, the disease or not, you know the population at risk. So in this case, risk ratios and odds ratios are adequate and you can use both. But we'll discuss a little bit more the advantage, disadvantage of each one and some characteristic of each parameter. But in summary, prospective studies, you can use risk ratio or odds ratio to investigate an association between a risk factor, exposure, intervention, and outcome, disease, condition. However, in one special condition, in a special situation, odds ratio and risk ratio are really similar. They will be calculated differently using different parameters because the denominator is different. But the numerical value, the parameter that you receive after the calculation will be very similar. And this is especially true for rare conditions, rare disease. Why? And I will show you why. In this graphic, this circle that I draw using Inkscape, a nice software, by the way, you are seeing the population, the total population, and in blue and pink. And the pink triangle is the population that developed the disease. If you calculate the risk, you will take the triangle, the pink one, divided by the total population. So the blue circle and the pink triangle. And the odds will be the pink triangle divided by only the blue circle. You can notice that both the denominators are different, but probably numerically they are very similar. So if you have the same numerator and similar denominator, risk and odds will be similar. So the ratio between risk and odds in the exposed and non-exposed group will be similar. So the numerical value, for example, an odds ratio of 1.84, you would find a risk ratio of 1.86. And some researchers, they argue that using the terms of increasing the risk in 84 or 86%, or increasing the odds in 84 or 86% is a matter of style. I confess that I prefer using the term of odds because odds was the real calculation, but explain that the factor investigated, the risk factor, the exposure investigated increase the chance to develop the disease. But this is true. Some researchers, they argue that you can use the term increase the risk, even though you use odds ratio to calculate the mathematical or numerical value to investigate this association. As I already described, even though you can use the same word, risk, they are not the same. One, risk ratio, are related to probability, and the other one to odds. And as I explained before, the denominator will change. Even though the numerical value could be similar, the denominator will change, and you are not using the total population at risk in denominator, so you should not use the term of risk. Instead, you should use odds. But there are some arguments in favor of using risk ratio instead of odds ratio, for example, in prospective study, when you are allowed to use. The first one is the interpretability. And sometimes in prospective studies, longitudinal studies, you will investigate a common disease, not rare disease. And odds ratio could give you a sense that the risk or the chance to develop the condition is really high. But if you use risk, you would have a more reliable parameter, describing that if you find a risk ratio of 2.4, mean that the exposure, the risk factor will increase the probability to develop the disease or the probability to die in 2.4 times. So it's much easier to interpret. So as I give this here in an example, a risk ratio of that is 1.5 when exposed to smoking. Based on this data, you can argue and infer that patients that are exposed to smoke will have 50% higher probability to die. Odds ratio of 1.5, you should not use the same message or interpret the same. You can say that it will increase the odds in 1.5 times of dying, but it's a very abstract parameter, especially if you are communicate this finding to general public or policymakers. One important parameter argument in favor of odds ratio is odds ratios are symmetrical. Why this is true? Odds ratio of no Y or no death or no disease is the reciprocal or inverse, the mathematical inverse of the odds ratio of Y, of the disease. And risk ratio is not symmetrical. Statistically, this is a particularly interesting characteristic. The odds ratio of not developing the disease is exactly the opposite of the odds ratio of developing the disease. So using our example, first let's start with risk ratio, and I will mathematically prove to you that the the risk ratio of no disease, not developing the disease, is not the reciprocal. In this case, the risk ratio, the risk of no disease in the exposed group is 7, because we have 7 blue circles, meaning 7 patients without the disease of a total of 18. So the risk is 0.38. And in the non-exposed group, we have the risk of not developing the disease, 12 patients, 12 blue circles divided by 18, in this case, 0.67. The risk ratio of no disease in this case was 0.38 divided by 0.67, which is 0.57. If you calculate just the reciprocal, remember that the risk ratio to develop the disease that we calculate in the beginning of this presentation was 1.84. 1 divided by 1.84, which is the reciprocal, is 0.54, not 0.57. But odds is exactly the same. So the odds ratio in the exposed group, the odds in the exposed group for not developing the disease is 7. Again, the numerator is the same, divided by 11, the number of patients that did develop the disease. And in the non-exposed group, the odds is 12 divided by 6. So in this case, 2. The odds ratio of no disease is 0.63 divided by 2, which is 0.31, which is exactly the same of 1 divided by 3.14. 3.14 was the odds ratio of developing the disease. So the reciprocal is symmetrical. The odds ratio is symmetrical, meaning the reciprocal of odds ratio of no disease, no Y, no our outcome, is the reciprocal of odds ratio of Y. So in conclusion, risk ratio and odds ratio are commonly used in clinical research, and we should understand carefully the difference and how we should interpret these. The calculation and interpretation are different for each parameter, but there are some cases, especially in rare disease, that we can interpret very similar, but still I believe that we should understand that they are not similar. They use different rationale, but the numerical value is similar. Risk ratio is easy to interpret from a clinical point of view, but odds ratio is more flexible. And this flexibility is especially true regarding the symmetric behavior. And being statistically interesting, and some statistical tests requires this symmetric behavior. That's why I believe odds ratio are very commonly used, but we should be aware that for common disease, common outcome, we should be very carefully how we interpret odds ratio. So that's the end of my presentation. I hope you enjoy, and let me know if you want to discuss any concept in more detail. I would love to discuss with you and hear from you what are your impressions and what do you think about risk ratio and odds ratio. Bye-bye.